Welcome to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to drive better patient care. Whether you're at the bedside or in leadership, your role is essential in shaping the future of healthcare. Today, we begin our 10-part series on case management, a topic that every nurse needs to understand. Why? Because case management isn't just about coordinating care, it's about advocating for patients, reducing hospital costs, and improving nursing efficiency. In this episode, titled Why Nurses Cannot Afford to Ignore Case Management, we'll explore why every nurse, regardless of title, plays a crucial role in ensuring patient care is seamless, efficient, and effective. Guiding today's discussion are two experienced registered nurses. James Carter, BSN, RN, an ICU nurse who understands the fast-paced challenges of bedside care. Emily Ramirez, MSN, RN, a nurse manager who is passionate about bridging gaps in patient care. Together, they'll dive into key insights from an article written by Dr. Nicholas Abella, founder of Healthcare Nurses Network, whose research emphasizes the power of case management in improving patient outcomes and reducing healthcare costs. So, whether you're new to case management or looking for ways to enhance your practice, this conversation is for you. Let's get started.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We're your go-to resource for all things nursing.
Absolutely.
So today, we're diving deep into a topic that's crucial for nurses at every level, and that is case management. Now, you might be thinking, wait, isn't that for social workers?
Right.
But trust me, case management is a powerful tool for every nurse, from bedside to leadership, to really elevate patient care and navigate the complexities of our healthcare system.
It is.
In fact, one study we came across showed how a bedside nurse, using case management principles, actually helped a post-surgery patient avoid readmission, just by connecting them with the right resources. That's the kind of impact we're talking about.
And you know what's fascinating is that many nurses already incorporate aspects of case management into their daily practice without even realizing it.
That's true.
You know, it's about taking that inherent patient advocacy we all have as nurses and expanding it, thinking about the patient's journey beyond our immediate interaction.
Okay, so let's break this down. We've got a stack of research articles, expert opinions. We even pulled a podcast episode from the renowned Dr. Abella. And it all points to one clear message. Case management is not just an added responsibility. It's a fundamental shift in how we approach patient care.
Yeah.
But before we get into the nitty-gritty, let's define what case management actually means.
Okay. So at its core, case management is about ensuring patients receive the right care at the right time in the right setting, from the right provider, and at the right price.
Wow.
It's about coordinating care across different teams and settings, advocating for the patient's needs, and empowering them with the knowledge and resources they need to manage their health effectively, even after they leave the hospital.
You know, that 5 rights framework is a fantastic way to simplify a sometimes complex concept.
It is.
It really highlights that holistic, patient-centered approach. That's at the heart of case management. And speaking of resources, I want to remind everyone that we have a ton of information on case management available on our website, healthcarenurses.net. You'll find articles, checklists, even links to some of the studies we're discussing today. So definitely check it out.
One of the most compelling arguments for embracing case management, especially for nurses who are already feeling overwhelmed, is the idea that it can actually save time in the long run. By investing a bit more time up front to coordinate care, anticipate potential issues, and equip patients with the knowledge they need, we can often prevent complications and readmissions down the line.
I can already hear some of our listeners thinking, easier said than done. How can I possibly add another thing to my already overflowing plate? And I get it. Nurses are incredibly busy.
Oh, yeah.
But think of it this way. If a patient is readmitted because they didn't fully understand their discharge instructions or didn't have access to necessary resources, that ultimately adds more work for everyone involved.
Exactly. It's about working smarter, not harder. And beyond the time-saving aspect, consider the impact on patient outcomes. Studies have shown that when nurses are actively involved in case management, patients experience better health outcomes, have fewer readmissions, and report higher levels of satisfaction with their care.
That's powerful stuff, and it speaks to the heart of what nursing is all about, advocating for our patients and ensuring they receive the best possible care, not just during their hospital stay, but throughout their entire healthcare journey.
And this is where that shift in mindset becomes so important. It's about moving beyond just treating symptoms in the moment and thinking about the patient's needs holistically.
One example that really stuck with me from Dr. Abella's podcast was about a nurse who noticed that a diabetic patient being discharged didn't seem confident
Yeah.
about managing their insulin injections at home. Instead of just assuming everything would be okay, the nurse took the time to review the instructions, answer the patient's questions thoroughly, and even arrange for a follow-up visit with a diabetes educator. That proactive approach, that's case management in action.
Absolutely. And while that might seem like a small thing, imagine the potential impact on that patient's health and well-being in the long run. By taking that extra step, the nurse may have prevented complications, reduced the risk of readmission, and empowered the patient to take control of their own health.
I love that. It really underscores how even small actions can have a ripple effect when it comes to case management.
And this brings us to a common misconception that we need to address head-on.
Okay.
Case management isn't my role. That's what social workers do.
I was just going to say, I bet a lot of our listeners are thinking that right now.
It's understandable, but it's crucial to remember that patient advocacy is inherent to nursing.
Right.
Our role goes far beyond simply providing medical care within the walls of the hospital.
Sure.
We are responsible for ensuring our patients' well-being extends beyond their immediate stay.
Okay, I'm convinced. Case management is definitely not just for social workers. But I still have one burning question. How do we, as busy nurses, actually find the time to integrate these principles into our daily practice? I mean, realistically, where do we even start?
Right.
We'll tackle that question and more when we come back for part 2 of our deep dive into case management. Don't forget to check out healthcarenurses.net for more resources in the meantime. We'll be back soon.
Sounds good. Welcome back to the Healthcare Nurses Network podcast. It's great to be continuing this depth dive into case management as we move forward. Let's shift our focus to how you can actually integrate this powerful approach into your own practice, no matter what your role is.
Yes. In the last part, we talked about what case management is and why it matters for nurses. Now, I'm really curious to hear some concrete examples and practical tips that our listeners can use right away.
Absolutely. Let's start with nurse leaders. One of the most important things they can do is champion case management principles within their teams. This means fostering a culture where nurses feel supported and empowered to think beyond the bedside, anticipating potential challenges, and advocating for the patient's needs throughout their entire healthcare journey.
That sounds great in theory, but what does that actually look like in practice?
Well, for example, nurse leaders can encourage proactive participation in discharge planning meetings. Often, bedside nurses have the most comprehensive understanding of a patient's individual needs and potential challenges.
That's so true. They're the ones who spend the most time with the patients, observing their progress and hearing their concerns.
Exactly, by actively listening to bedside nurses and incorporating their insights into the discharge plan. Nurse leaders can help create a more comprehensive and effective plan. That truly sets the patient up for success.
That makes a lot of sense. And speaking of bedside nurses, how can they start incorporating case management principles into their daily routine?
One really practical step is to get familiar with the community resources available to patients. Post-discharge, think about support groups, transportation services, home health care options, even financial assistance programs, anything that can help smooth the transition back home and address the patient's unique needs.
It's about recognizing that our responsibility as nurses doesn't end when the patient walks out the door.
Right. And one of the most valuable tools we have as bedside nurses is our ability to educate and empower patients. We can take the time to explain things clearly, answer questions thoroughly, and ensure the patient feels confident and prepared to manage their health at home.
This reminds me of a study we came across about a bedside nurse who took the initiative to connect a diabetic patient with nutritional counseling services. After discharge, the nurse recognized that the patient might struggle with dietary changes and wanted to set them up for success.
That's a perfect example of case management in action. It's about being proactive, anticipating potential challenges, and connecting patients with the resources they need to thrive. And those seemingly small actions can make a huge difference in a patient's long-term health outcomes.
I'm sure many of our listeners are resonating with these ideas, but might also be feeling a bit overwhelmed. So let's address the elephant in the room, the ever-present time crunch that nurses face. How can we possibly squeeze case management into our already jam-packed schedules?
It's a valid concern, and one we hear all the time. The key is to remember that effective case management isn't about adding a bunch of extra tasks to your plate. It's about working smarter, not harder. By investing a bit of time upfront to coordinate care, anticipate potential problems, and thoroughly educate patients, we can often prevent complications and readmissions down the line, which ultimately saves us time in the long run.
So it's not about doing more, it's about doing things differently.
Absolutely, and the research really supports this. Studies have shown that nurses who actively participate in discharge planning, for example, see a 15% reduction in patient readmissions, freeing up valuable time for other crucial tasks.
That's a compelling statistic. It really highlights how case management can benefit both patients and nurses.
And beyond the time-saving benefits, think about the professional satisfaction that comes with knowing you've played a role in improving a patient's overall well-being. When we empower patients to take an active role in their own health and see them thriving after discharge, it's incredibly rewarding.
I completely agree. But I know some nurses might still be hesitant, feeling like case management is outside their traditional role. We often hear, that's what social workers are for.
That's another common misconception we need to address. While social workers play a vital role in the case management process, it's essential to remember that patient advocacy is inherent to nursing. Our responsibility extends beyond providing medical care within the four walls of the hospital. We are advocates for our patients' well-being throughout their entire healthcare journey.
So how can we start shifting that mindset and see case management as an integral part of our role as nurses?
One great starting point is self-reflection. Ask yourself, how do I currently think about continuity of care? Do I consider what happens to my patients after they leave the hospital? Am I actively involved in discharge planning? By simply reflecting on these questions, we can start to identify areas where we can incorporate case management principles into our daily practice.
I love that. It's about starting with awareness and then taking small but impactful steps.
Exactly. And remember, you don't have to do it all alone. Lean on your colleagues, your nurse leaders, and the resources available to you. Collaboration is key in case management.
This has been such an insightful conversation. We've covered a lot of ground, from understanding the core principles of case management to exploring practical ways nurses can incorporate this approach into their daily routines. And we've addressed some of the common challenges and misconceptions that might be holding nurses back. But before we wrap up this part, I want to remind everyone to check out healthcarenurses.net for additional resources on case management. We've got articles, checklists, links to studies, and more to support you on this journey.
We'll be back for part 3 of this deep dive soon, where we'll delve into some real-world case studies and offer even more practical tips for nurses at all levels.
Welcome back to the Healthcare Nurses Network podcast for the final part of our deep dive into case management. We've explored the what, the why, and the how, but now I'm really excited to bring this all together with some real-world scenarios.
I think these examples will really illustrate the tangible impact case management can have, not just on patient outcomes, but also on our own professional satisfaction as nurses.
Exactly. So let's dive in. What kind of situations have you seen where case management made a real difference?
One case that really stands out involved a young patient who was admitted for a serious respiratory infection. He had a complex medical history and required a lengthy hospital stay. The bedside nurse, recognizing that he would need ongoing support after discharge, took a proactive approach.
What did that look like?
She started by carefully assessing his home environment and support system. She discovered that he lived alone and had limited family support nearby. This raised concerns about his ability to manage his medications, follow up with appointments, and adhere to the recommended treatment plan.
That's a red flag for sure.
Yes.
So how did the nurse address these concerns?
She used the SBI technique, Situation Background Assessment Recommendation, to communicate her concerns to the physician and social worker. Together, they devised a comprehensive discharge plan. That included home health care visits, respiratory therapy, and social services support.
That SBR technique is so valuable. It provides a clear and concise framework for communication, especially in complex cases like this.
Absolutely, and the results were remarkable. The patient was able to transition back home safely and effectively, avoiding readmission and achieving a full recovery. And the nurse was incredibly gratified to see her proactive efforts make such a tangible difference in his life.
That's a fantastic example. It really showcases how nurses can use case management principles to advocate for their patients and navigate the often complicated healthcare system.
It also highlights the importance of collaboration. Case management is rarely a solo effort. By working effectively with physicians, social workers, therapists, and other members of the healthcare team, we can create a seamless and supportive experience for our patients.
So let's bring this back to our listeners. What's one piece of advice you would give to nurses who are just starting to incorporate case management into their practice?
I would say start small. Identify one patient this week who you think could benefit from a more thorough discharge plan or a bit more proactive follow-up. Talk to your case manager or social worker, explore the resources available, and see what you can do to make a difference in that one patient's life.
I love that. It's about taking those small but impactful steps that ultimately lead to big changes in patient care.
Exactly. And remember, you are not alone on this journey. Reach out to your colleagues, mentors, and resources like the Healthcare Nurses Network. We're all in this together, striving to provide the best possible care for our patients.
And speaking of the Healthcare Nurses Network, I want to remind everyone to visit healthcarenurses.net. For a wealth of information and resources on case management, you'll find articles, checklists, links to studies, and even a forum where you can connect with other nurses who are passionate about this approach.
It's a fantastic resource for nurses at all levels.
Well, this has been an incredible deep dive into case management. I hope our listeners are feeling inspired and empowered to embrace this approach and truly make a difference in the lives of their patients.
Me too. It's been a privilege to explore this topic with you and share these insights with our amazing nursing community.
Thank you for listening to the Healthcare Nurses Network podcast.